Welcome back to Tuesdays with Timeless. I'm Dr. Stephanie Christian. 2 weeks ago, I talked about using IPL or limelight to treat solar lentigines, which are the brown spots you get from sun damage. I got 2 very good questions in response to that. One was, what about the brown spots on your face that aren't solar lentigines? And the other was, what about patients that are dark-skinned and their brown spots, because you can't treat the whole face with IPL. So today, I'm going to talk about the treatment of benign pigmented lesions and the treatment of pigmented lesions in people of color. So, what are these benign pigmented lesions? I'm going to take the easy ones first. The first is cherry angiomas, and almost everyone at some point is going to develop a cherry angioma. These are those little red pillow-like lesions. They look like a mole, but they're ruby red. They are benign. They are collections of little venules, so little vascular lesions under the skin. They develop in people beginning at about age 30, so you almost never see them in children, and they do tend to run in families. And I have 2 different lasers that can be used to treat these. They are very effectively treated. I did have a patient once that wanted every single one of them on her body treated, and we treated over 1,400 in one sitting. Most people don't necessarily want every single one treated, and most people don't have that many at one time, but they are very easily and very effectively treated. The next very common benign pigmented lesion is skin tags. And these are very fleshy, skin-colored, soft lesions that are usually on a stalk, although when they begin to form, they're usually flat and raised, and then the stalk develops later. They usually form on the neck, under the arms, under the breasts, and in the groin area. And they form because of the irritation that happens when skin rubs against skin or when cloth rubs against skin. I do have a laser that will treat these, but I want to evaluate them first and make sure that that's actually what they are and that you're a good candidate for them. Almost everyone will develop at least one skin tag some point in their lives. The next benign pigmented lesion is seborrheic keratosis. These are those waxy lesions that look like they're stuck on. You almost feel like if you got your thumb under one edge, you could peel it off, but you can't because it really is a lesion and it's stuck everywhere. They often start out white and then turn tan color, and then they develop and can progress to either brown or black. They are most common on the back and sometimes on the chest, but sometimes people do develop them on the face. They can be itchy. They're almost never painful. Some families are more prone to developing SEBCAs. Once again, you can see a dermatologist about these. In the past, dermatologists did treat these with freezing or with electrodesiccation. There is now a prescription that they will write for something that contains 40% hydrogen peroxide. If you've tried this and it doesn't work, I do have a laser, but I only use it on SEBCAs on the face. I won't treat the ones on the body. Sometimes people have thousands of these. I want to see you and do a consultation and make sure that it actually is a SEBCA, and I want to make sure that the skin underneath is appropriate for a laser treatment. And then last but not least, and this is an interesting one, is dermatosa papulosa nigra. And this is actually a variant of SebK. And we tend to see this on the cheeks, the temples, and the forehead, and the necks beginning in adolescence. In medium dark to dark-skinned people who have their ancestry in Asia and Africa and Mexico. And the darker they are, the more they have. Also tends to run in families. And because of where they are, there seems to be something that's associated with sun exposure. So although sometimes it's a little hard to convince dark-skinned people to wear sunscreen, I always have to remind them, Bob Marley died of melanoma. So even dark-skinned people need to wear a good sunscreen. Because this tends to happen in people who are dark-skinned, I like to do test spots off of the face, on the neck. I like to find the right spot size, the right energy level, and make sure that we've got exactly the right thing, because there is a very small risk of hypopigmentation. It happens rarely, and usually when it happens, it's temporary, but because of that, I like to work on the neck first and then go to the face. So once again, I really like feedback from these talks, because as you see, I got really good questions from the talk I did 2 weeks ago that led to the topic for today's talk. Have a great week. Thanks for being with me today. Stay well.